Hello, and welcome to the Brookshire Brothers Medicare Part B Claim Billing Training. Today we will walk through the steps of properly billing a Medicare Part B claim, as well as discuss the documentation and forms necessary to be compliant. All of the information we will cover can also be found in the Allwyn Medicare Part B Billing Manual, which can be found under the Documents section of the Pharmacy page on CSOP. A printed copy of the manual should also be available in your pharmacy at all times for quick reference. Let's start by taking a look at the items that may be billed to Part B at your pharmacy. These include certain types of durable medical equipment, also called DME or DMEPOS, as well as several classes of medications. Medications that are billed on assignment, or those that are covered by Part B, include oral immunosuppressive agents, oral anti-cancer drugs, oral anti-emetics, inhalation drugs administered through a nebulizer, certain drugs including insulin administered through an external infusion pump. Please note that we are unable to bill nebulizers, only the nebulized medications. The certification to bill nebulizers requires a pharmacist to be available 24/7 for patients. Since we do not have any 24-hour pharmacies, we do not meet these requirements. There are several items listed as DME that are covered by Part B. The most common items you'll bill for are diabetic testing supplies, like glucometers, test strips, and lancets. Other Medicare Part B covered by DME items include OSTOMY supplies, however we are not certified to bill for these, urological supplies, surgical dressings, surgical supplies, internal nutrition administered through a G-tube, seat lift mechanisms, walkers, canes and crutches, diabetic footwear, prosthetics and orthotics. If what you are billing is not on these lists of drugs and DME, do not accept assignment. Bill as unassigned, meaning the customer pays 100% of the amount. Before we get started on the billing process, let's review the various documents you'll need along the way. When you first identify that you have a Medicare Part B patient for whom you'll be billing for, you'll need to make a folder for that person in your file cabinet. Take a manila file folder, write the patient's name on the tab, and attach a refill request log to the inside cover using a paper clip, or you can just staple it. The refill request log is used to document refill requests for DME prescriptions and must be kept in the patient's file. DME items cannot be set up for automatic refills or MedSync. Every new Medicare Part B patient needs to be given a Medicare Part B beneficiary packet. It's best to have several of these packets made up in advance so that you don't have to waste time printing the documents once you realize you're billing something to Part B for a patient for the first time. The items you'll need to include in each packet and make sure are completed prior to billing a prescription are Scope of Service Welcome Letter. There's a welcome letter specific to your pharmacy in the Medicare Part B folder on CSOP. This letter lists your pharmacy's contact hours and information related to various services you offer. Patient Rights and Responsibilities. This is a document outlining what rights and responsibilities the patient has as it relates to your pharmacy and the billing of medications and/or DMEPOS to Medicare. It also lists the Medicare DMEPOS supplier standards and complaint information. Notice of Privacy Practices. This is the same as the HIPAA Notice of Privacy Practices that you already give to each new patient. Detailed Written Order, either the diabetes or non-diabetes version. The detailed written order form, diabetes, should be filled out by the patient and faxed to the prescriber whenever you are billing diabetes testing supplies and/or insulin for a pump to Medicare Part B. The detailed written order form, non-diabetes, should be filled out by the patient and faxed to the prescriber whenever you're billing any other type of DME POS or Medicare Part B covered medications. The patient will need to fill out the top half of the page. You may help them if needed. Be sure to get their Social Security number as well as their Medicare number, as they may not be the same. For the section that asks if the equipment is rented, purchased for home use, etc., you will likely always choose purchased, since we do not rent out any equipment. Be sure the patient signs and dates the form. Once the patient portion of the form is complete, you will need to fax the form to the patient's prescribing physician so he or she can complete the bottom half. You cannot bill Medicare for the items until you receive the completed form back from the prescriber. Assignment of benefits and appointment representative form. Complete the form for every new prescription and keep it in the patient's file folder. You do not have to complete this for refills, just every time the prescription is renewed and gets a new prescription number. This form must be kept on file for 10 years. The bottom section only needs to be completed if the patient wants to appoint a representative to sign on their behalf. Medicare Part B DMEPOS Proof of Delivery. This form must be completed and signed by the patient for each prescription that is picked up and/or delivered to a patient. Keep each completed form in the patient's file folder. You may also scan it into the patient's profile in the pharmacy system under the Medical Authorizations tab. Either way, you still need to keep it in the file folder. Medicare Customer Satisfaction Survey. All patients must complete this satisfaction survey and it must be kept in their file for 10 years. Whenever a patient returns a completed survey, you will need to fax it to the Pharmacy Help Desk at 936-633-4678. Advanced Beneficiary Notice. Complete this form anytime there is doubt about a product being covered or if the allowance has been used for a product. For example, Medicare B only covers a glucometer every 5 years, so if a patient needs one sooner than that, you'll need to complete the ABN and have the patient pay cash for the glucometer, unless they have some other insurance or a coupon that will cover it. There are a few other forms that you may need to use from time to time. These are the Certificate of Medical Necessity, CMN, and the Physician License Verification Form. The CMN should be completed anytime the patient's utilization exceeds Medicare's guidelines. An example is if the patient is testing their blood sugar 4 times daily and Medicare only allows testing 3 times daily. Completed CMNs must be kept on file at the pharmacy for 10 years in the patient's Medicare folder. In the event you need to have a CMN completed, contact the Pharmacy Help Desk for assistance finding the correct version of the CMN. The Physician License Verification Form should be completed if the physician's license information is not already listed in the Physician License Verification Database found on the pharmacy page of CSOP. If the physician's name is not listed on the spreadsheet, you will need to complete the Physician License Verification Form and fax it to the Pharmacy Help Desk at 936-633-4678. To verify the physician's state license information and NPI, use the links found on the Enterprise homepage Links section. Once received, the Help Desk will update the spreadsheet on CSOP. This only has to be completed if the physician's name is not already on the list. If they are listed, this means their license and expiration date have already been verified. Once the detailed written order is received back from the prescriber, you can then bill the claim. The third-party plan code you'll use to bill is called ALLWIN, A-L-L-W-I-N. It is code number 10471. The ID number is the Medicare number listed on the patient's card. This may be their Social Security number with a letter following, or it may be a series of numbers and letters. No group number is needed. If the patient has a secondary insurance they'd like to use, follow the procedures for adding the secondary insurance. We'll review this in an upcoming section. Once this information is added to the patient's enterprise profile, type the prescription, add the diagnosis code ICD-10, and finish filling the prescription. Claims for the nebulized medications require that a nebulizer date of purchase be entered into the prior authorization field in the format 4-digit year, 2-digit month. Have the patient estimate the month and year that they purchased their nebulizer and submit this date. The patient will need to complete the proof of delivery form each time they pick up a prescription billed to ALLWIN. This is in addition to them electronically signing for their prescriptions at pickup. Scan this into the patient's profile in Enterprise and file the original in their file folder. The patient should also be given a customer satisfaction survey to fill out. DME prescriptions that are not picked up must be reversed and returned to stock within 10 days. If you need help with rejected claims or have questions, contact the Pharmacy Help Desk at extension 4720. As mentioned earlier in this lesson, Medicare B alone only covers 80% of the prescription. If the patient has a secondary insurance, you'll need to do the following. First, look at the insurance company in the COBA, or Coordination of Benefits Agreement list. There is a link to the COBA list on the Enterprise homepage in the Links sections. If the insurance company is listed, populate the Group ID field of the All-One plan in Enterprise with the COBA ID listed. For example, Liberty National is 55005. Enterprise will return a $0 copay because the group indicates that the patient has a secondary insurance that will pay the 20%. Medicare actually ends up billing the secondary insurance 20% on our behalf, and the secondary sends their payment back to us. If the insurance company is not listed on the COBA list, then you'll need to add the plan information to Enterprise as a COB, like you would for any other COB, assuming the patient hands you a card with a BIN, PCN, ID number, etc. Medicare establishes specific quantity limits for many items billable as DME. For some items, Medicare's published limits are absolute. For other items, Medicare allows for quantities over the published limits to be billed as long as certain documentation requirements are met to support the excessive quantities. The most common example of this is diabetic testing supplies. For a patient who is currently being treated without insulin injections, Medicare allows 100 test strips and 100 lancets every 90 days. For a patient who is currently being treated with insulin, Medicare allows 100 test strips and 100 lancets every 30 days. When a patient is testing their blood sugar over Medicare's guidelines on diabetic supplies, All-One will reject the claim and tell you that utilization exceeds limit. If the prescription specifies the frequency, indicate medical necessity by submitting a submission clarification code of 07. Please note that the pharmacy is not required to collect glucose testing logs. However, evidence of the beneficiary's testing must be in the prescriber's medical record for the patient. The patient has the right to freely voice grievances and recommend changes in care or services without fear of reprisal or unreasonable interruption of services. Service, equipment, and billing complaints will be communicated to management and upper management. You will need to document these complaints on the Customer Complaint Report found in the Medicare Part B folder on CSOP. Be sure the complaint form is filled out in its entirety and fax it to the corporate pharmacy department. All complaints will be investigated, acted upon, and responded to in writing or by telephone by a manager within a reasonable amount of time after the receipt of the complaint. Dispensing incidents that involve DME will need to be handled in the same way as any other dispensing incident. You must fill out the Report of Dispensing Incident form immediately and fax it to the number listed on the form. This form is located on CSOP. Follow the dispensing incident procedures listed in the Quality Assurance section of the Pharmacy Operation Manual. It is important for all pharmacy personnel to understand what Medicare Part B is, what items and medications are covered or not covered, and what we are responsible for as a provider of this service. Ensuring that Part B claims are billed and documented appropriately will help protect your pharmacy should you ever get audited by CMS. Prescriptions that are audited and found to have been billed incorrectly or that lack proper documentation could cause Medicare to withhold or take back payment for items or medications already provided to the patient. This concludes our review of Medicare Part B billing and procedures. If you have any questions, contact a member of the Pharmacy Help Desk at 936-634-8155, extension 4720. Thank you for your time.